Are we as physical therapists explaining what we're doing with our manual treatment well enough to the patient that makes sense that we're doing what we're actually doing and for them to understand it?
Yeah, I think that's a good question. I mean, I think when we explain our interventions to our patients, they have consequences. And the way that we really have learned manual therapy in school and maybe even continuing education courses have been heavily driven on a biomechanical basis or biomechanical theory. And really, the literature just does not really support that theory as well as we once thought. So, our explanations that I see a lot of clinicians tell tend to be more biomechanically driven. And that's not necessarily how our interventions are effective or how they're kind of working. So I think we really, as a profession, need to move forward with how we're explaining things to make sure that patients clearly understand the effectiveness of how we're making them better.
So when you say biomechanical, we're talking kind of joint alignment. If that's not the ultimate goal of manual therapy, how is our manual therapy working?
Right. I mean, that's like a loaded question in itself because, right. So a lot of what we learned was considered a corrective theory where we're looking at joint position and we're looking at symmetry and we're really trying to make things open and close and we're looking at mechanics of the spine. But how our interventions are effective from a manual perspective tends to be more neurologically driven, or what the literature deems neurophysiological effects. And these effects are quite robust. And we clearly don't understand exactly how manual therapy works because it's a very complex it's a complex way of studying it. It's really hard to study manual therapy because there's all these different types of interventions and there's a lot of effects that occur. So it's hard to kind of control all of those variables. But as a whole, the literature is really pulling us in a certain way. And this way tends to be more so looking at the nervous system and the brain and like non-specific effects that occur.